Okay, my name is Amalia Khayanisa and I will do a GCS assessment or Glasgow Coma Scale assessment. Glasgow Coma Scale assessment is a clinical scale used to reliably measure of a person's level of consciousness after a brain injury. The GCS assessment has three scales. The first is eye assessment, and the second is verbal assessment, and the third is motoric assessment. The eye assessment has four stages. The first stage is when we will try to assess the patient, but the patient can open their eyes without any instruction, just like this. Okay, the patient can open their eyes without any instruction. The score of the scale is 4. The second is when the patient can open their eyes when we ask their name or we ask there to open their eyes, just like this. Miss, can you open your eyes? Okay. The score of this assessment is 3, and the next assessment is when we give pain to patient while we call their name, just like this. Ma'am, can you open your eyes? The score of the scale is 2. The last assessment is when we give the patient pain and ask for the patient to open their eyes, but there is no response from the patient, just like this. Ma'am, can you open your eyes? Ma'am? When the patient cannot open their eyes, the score of the assessment is 1. The second assessment is verbal assessment. The scale of this verbal assessment has 5 stages. The first stage is when the patient can answer the question correctly, just like this. Excuse me, ma'am. Can you say who is your name?
My name is Ian.
Okay, how old you are?
I'm 18 years old.
Okay, thank you. The score for this stage is 5. And the second is when we ask the patient and the patient can answer, but they need a time to answer this, just like they confuse to answer the question. Okay, ma'am, can you say who is your name?
My name is Dian.
How old you are?
I'm 18 years old.
Okay. The score for this assessment is 4. The third stage is when the patient cannot answer the question correctly, and or the answer is wrong, just like this. Okay. Ma'am, can you say who is your name?
I'm okay.
How old you are?
Tomorrow.
Okay, thank you. The score for this assessment for the scale is 3. The next is when the patient cannot answer, but they just give a mumble, just give a voice from the question that we give. Ma'am, ma'am, can you say what's your name? Can you tell me how old you are? Okay. The score for this assessment is 2. And the last is when the patient cannot answer and didn't give any response from the question that we give. Okay. Ma'am, can you say what's your name? Ma'am. Okay. The score for this scale or stage is 1. Okay, the last assessment for GCS assessment is motoric assessment. This motoric assessment has 6 stages for the response from the patient. The first is when the patient follow the order correctly, just like this. Ma'am, can you put your right hands up? Okay, thank you. Can you put your left hands up? Okay, thank you. The score for this assessment is 6. The second is when the patient can pull over the pain that we give, just like this. Ma'am? The score for the assessment is 5. The third stage is when the patient can avoid the pain that we give, just like this. For this stage, the score of the assessment is 4. The next is when the patient, when we give a pain to the patient will give flexion responses, just like this. Okay, the score for this assessment for this stage is 3. The next is when we give pain to the patient will respond with the extension responses, just like this. The extension response from the patient has score 2. And the last is when we give a pain to the patient, there is no responses from the patient, just like this. Ma'am, can you open your eyes? When there is no response from the patient, the score for this assessment is 1. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.